Dr. Atai Omorut led a medical team of expatriates to West Africa, particularly to Liberia, during the worst period of Ebola in West Africa that claimed over 8,000 lives. And in a time when most people would have preferred not to care because it's not their country, they decided to go there and save lives. And tonight, we talked to her about what it was like in a foreign country surrounded by death, fear, to stand and do the best they could. Welcome, Doctor. When Liberia was hit by Ebola, you were not obligated to go there because it is not Uganda where you would have been obligated to save lives because you know that eventually it's bound to spread all over. Why did you choose to go to Liberia?
Liberia experienced the first case in March 20th actually, of 2014. And this was in the northern parts of Liberia, adjacent to Guinea. So the government of Liberia immediately, with the assistance of World Health Organization, moved in and they were able to control that outbreak. It did not spread. And actually the country went for 6 weeks without a new Ebola epidemic, and they actually declared Liberia Ebola free. But it wasn't for long. In May, they got a second wave of the Ebola outbreak. And this was the deadliest wave that they got. So, because it was a new disease, the country was not prepared, the health infrastructure was quite weak, they sought help from the World Health Organization again, the country office in Liberia. So the World Health Organization also saw that the situation was actually great, so they requested the regional office of the World Health Organization to seek expatriates, people who had experience in management of Ebola. So the WHO Afro office, which is in Brazzaville, Congo, wrote to the WHO country office in Uganda requesting for people who are experienced and who could volunteer to go to West Africa. So an email was sent out because there is a database of some of us who have participated in the management of Ebola, Marburg, yellow fever, all these hemorrhagic fevers. So an email was circulated and I responded. I was willing to go because, one, I felt I could make a difference. We have had Ebola in Uganda several times. We have managed Ebola successfully in many cases. We have had another disease called the Marburg disease, which is like a cousin to Ebola, which we again have managed successfully. So I felt that I could make a difference.
How were you able to manage the situation and what did you find?
First of all, when I arrived in July, the situation itself was really bad. There were so many sick people. So many. There was the health infrastructure was not able to handle the cases. There were too many cases. There was no treatment unit. There was one treatment unit for Ebola. All the hospitals had closed. Imagine Mulago closed, Nsambia closed, Mengo closed, IHK closed. You know, all the hospitals, all the government hospitals were closed. Patients had nowhere to go for treatment. They were dying. People were dying on the street. People were dying in the market, on the beach, wherever the disease would fail them. They just dropped dead and they stayed there. The sick actually started following the health workers to their homes for treatment because the health facilities were closed. So they ended up infecting the health workers. So very many health workers died. So there was the system for collecting people from their homes, the sick, to bring them to the treatment unit was not there. There were not enough ambulances to collect the patients. The system for removing the dead bodies from wherever they are dropped for safe burial was not there, because there were not enough vehicles to pick, enough hearses to pick up the bodies and take them for burial. The people didn't understand what Ebola was, so they did not take the precautions that were necessary to prevent the continued transmission of Ebola. So the situation was full of panic. The government didn't know what to do. They were being overwhelmed. I can only equate it to the genocide pictures that we saw of Rwanda. There were dead bodies literally littering the streets of Liberia.
Was it fear or lack of preparation that got the country into such a terrible state?
I think it was a combination of factors. First of all, this was the first time they were experiencing Ebola. Then, secondly, the way Ebola presents in a patient, especially in the initial stages, is not specific. So it comes like it's malaria, it comes like it's typhoid, it comes like it's cholera, and those are diseases which are endemic in Liberia. So everybody thinks, no, it's not Ebola, this is malaria, this is typhoid, this is cholera. By the time they realize that it's Ebola, it has already spread to the next 10 people or so from one person. So the lack of awareness or knowledge about the way Ebola presents and spreads, that they were a naive country. They are naive to Ebola. So that contributed a lot to the rapid spread. Two, the health infrastructure, as I said. This is a country that has just come out of a war situation. They've had a lot of wars, and they were just beginning to rebuild the country. So Ebola came when they were still not yet strong enough to handle a medical problem of that magnitude. Then thirdly, the cultural practices. The cultural practices in Liberia, and I can only speak for Liberia at the moment, but I think generally in West Africa, the way the community handles their dead bodies, they are very intimate with their dead bodies. The community, they bathe the dead body, they brush the teeth, they comb the hair, they clean them every day for about 21 days before they bury, believing that they need to prepare the person to go to heaven. So, as we know, it is the dead bodies that are actually more infectious than the living, because the virus is getting out of the person. It needs to go to a living person. So there is a lot of virus on the surface, in the fluids, running away from the dead body. So the moment there is contact with the dead bodies, there is no way a person can escape from getting infected. So the practice of bathing, and then everybody, all the relatives, use that water to wash themselves. That is how they feel that they are, sending off their loved one. So this, I think, contributed the most to the rapid spread. So the government was taken unawares. There was not much that they could do, given the underlying circumstances.
Was there a time when you felt like giving up, surrounded by death, surrounded by fear? Even your team, was there a time they wanted to just give up and walk away?
Well, there are moments. It's a very stressful situation. Seeing people dying every day, you reach a point where you wonder whether you're making any difference, especially at the beginning. It was very traumatic to my team members and myself. It's not easy. Sometimes you put in a lot of effort on a patient. You even see them coming up. Some of them were surprise deaths, and those are the worst. You see somebody come out of a state where you knew they were going to die. They're able to sit, they are talking, they're able to, help themselves walk a little, and then they just drop dead, just like that. That is what really was breaking down some of my team members. But with every patient that we lose, maybe we can have 2 that we save. And those 2 that we saved kept the team going. We recorded some wonderful discharges of Ebola survivors, and that motivated the team. So instead of dwelling on the deaths, we kept telling ourselves that we know Ebola kills. We expect someone to die when they get Ebola. So if we are able to save them, then we have done a lot. And that kept them going.
Having been there and seen our country, Uganda, what lessons can we learn? Because 2015 is here, and there is so much that could go wrong. So many new crises could arise. How best can we prepare?
Well, there's a lot to learn. First of all, this epidemic has been so prolonged. As a clinical team, we have seen so many different presentations of this Ebola. Not like ours, which ours have been short. They were really pretty short outbreaks. How do you recognize an Ebola case, for example? 2, infection prevention and control measures at all the health facilities need to be strengthened. We should not have a situation where a nurse or a cleaner does not have gloves while they're touching patients, does not have an apron while they are handling people who are vomiting and things like that, where there is no disinfectant like Jik at the health unit, because Jik kills most germs. So once you have a disinfectant like that, then you're likely to avoid especially infection of the health workers. So I feel that such preparedness, and then of course research. We need to have a research fund so that we are able to investigate further the reasons, like the question you ask, where is this Ebola coming from? We should be able to carry out research on bats, on baboons, on monkeys, to find out where exactly. We have the forests, we have the baboons, and the Ebola comes to us. So we should be able to follow the Ebola backwards. So there must be a research fund to facilitate that. Innovative treatment. There should be a research fund to help us study drugs which can actually treat Ebola. We should not go into a panic mode. We should be able to say, yes, this is Ebola, this is the treatment, this patient is going to survive the Ebola. So I feel once government does some of those things, we shall be at a very good level of preparedness. Of course, there's collaboration with other advanced countries that have laboratories, that have therapeutic industries that are much more advanced. I think bilateral collaborations would also help us a lot.
Was Dr. Atai Omorut giving us the story of what transpired in Liberia, where she led a medical team in July 2014 to help save the situation when West Africa was hit by the worst Ebola case ever recorded. WBS Crime News continues.